The specialization offered in population and public health here in the Department of Community Health Sciences at the University of Calgary is a place to really grow and learn, thinking about an interdisciplinary approach to looking at health problems, but also solutions. How is it that certain populations, certain groups of people have better health outcomes than others? First of all, we tend to think about basic access to medical care, and of course this is very important. But unfortunately, it's not enough. Even when people have equal access to medical care, they don't all have the same health outcomes. And this is a specialization that looks to understand why and what can be done about it. So it's really about a social justice, a social determinants approach. We are privileged to work with students who come from a variety of backgrounds. Some come from the social sciences, some come from biology, some come from chemistry, some come from microbiology. But what is really unique and distinct about this specialization, this field, is that we really want to look at culture, we look at society, we look at policy, and we look at community organizations and agencies. And we think and help to shape how all those interactions take place for the betterment of all. And in my own team, we really emphasize people's relationships and interactions with non-human animals. And we do that not by so much looking at questions like pet therapy or visiting nursing homes, but why is it if you're an older adult, even in Calgary, it's so difficult to maintain a pet because you can't keep your housing and have the pet at the same time. Similarly for younger adults just starting out. And we know that things like having a dog are positively associated with social networks, with physical activity, with being out and about in the neighborhood. So there's a broader benefit, but it's actually really difficult if you're in a lower socioeconomic status situation to even have a dog, even a cat, even a bird. And of course, people, depending on where they're coming from in the world, they don't have the same views on these animals. So sometimes it can be very difficult to be living in a neighborhood or in an apartment building where your next door neighbor is engaging in a practice that you may find very difficult to understand or even find disgusting. So these are the kinds of things that animal welfare organizations have to work with, that the City of Calgary and similar municipalities have to work with, veterinarians, social workers, and of course, people who are trained in population and public health. We have an important role to play in bringing these different voices together. The website that we have for our team, which is at www.ucalgary.ca/MROCK, MROCK. There's information about my own background in anthropology, in social work, in health promotion, and also about a number of collaborators, and especially I want to emphasize 3 just outstanding PhD students from whom I learn week to week. Thank you.